Hello, my name is Piotr, and I'm a founder and CEO of Feyenally. I saw some of you were wearing glasses, and I bet some were wearing contact lenses. So I just want you to recall the last time you had your vision checked. I bet you had to leave home, drive to the doctor's office, sit in the waiting room, then you were asked to go in, sit on a chair, and you were asked to cover your one eye, then the other eye, and just keep some sort of symbols from the wall. That doesn't sound very convenient, does it? But actually, it was a privilege. There are over 1 billion people globally that do not have access to proper eye care. And uncorrected refractive errors mean that almost 700 million of them might lose vision. But what exactly are refractive errors? This is how normal vision looks like. This is short-sightedness. This is farsightedness. So how can we fix this problem? Well, having your vision fixed requires testing your eyes. And today you have to go and see the specialist offline in person, and the tests rely on a specialist, and there are not enough specialists. What's more, the specialists use obsolete and subjective methods. So what can we do? Well, we have a solution. Our mobile app can allow you to test your eyes instantly just with your smartphone. No special hardware required. You may think, but traditional tests are kind of complicated. It's a long line of questions. Do you see better or worse? Better or worse? Better or worse? And keep going. So how can this be replicated in an app? Well, we get rid of this process by implementing objective methods. So all you do is take a picture of each eye guided by our app, and we do the rest. How? By analyzing your pictures with our neural networks. And you can then use these results to buy corrective glasses online. We believe there is a huge market for Feyenally. We will monetize the solution through B2B2C model. We team up with private healthcare providers and e-commerce eyewear businesses, and they cascade the use of our solution to end users. We will start with developed countries where the focus is on increased convenience. We save time, save hassle, save money. But in developing countries, we can save something more precious. The sight of 700 million people. For most of them, this might be the only chance to have their eyes tested at all. And in developing countries, we will operate in B2G2C model. In order to pull a project like this, we need a team that comes from unique backgrounds, science, business, technology, and we believe we created a perfect blend that contributes to the success of Feyenally. My co-founder, Matt, has a long optical experience. I scaled online businesses successfully. Michael is a pro in international sales, and Joanna and Wojtek joined our core team, bringing the ophthalmology and AI skills respectively. Traditional methods that are available on the market have the accuracy of like plus minus 0.5 dioptries. We already matched that after gathering data from over 500 people, but we are not satisfied. We filed for patent protection, and next year we are going to gather more data. This will help us reach an accuracy of plus minus 0.25 dioptries, twice the current accuracy. This is revolutionary. Also, next year we will certify as a medical device in European Union, and by 2026 we want to perform 1 million eye tests online. Why are we that confident? Because we already have signed LOIs with big partners. How do we fund all this? For further tech development, we need around $1 million. That includes the medical device certification. The same amount we need to grow sales starting from 2025. And our total funding for the next year and a half right now is $2.8 million. So today, ophthalmology faces so many pressing questions. How can we save time? How can we save money? How can we save sight? The answer is obvious. Finally, it is there for all to see. Thank you very much for your attention. I greatly appreciate it, and happy to answer any questions now.
Maybe a first question on my end, which will be very similar to the first question I asked previously around your go-to-market strategy. So you mentioned that you already had LOIs with partners. So what kinds of partners are we talking about? And also, which type of business model and monetization scheme have you in mind?
So our first focus is European Union and developed countries in general. So we have LOIs from one of the biggest private healthcare providers in the region. We want to use B2B2C for this scenario. So team up with private healthcare providers, team up with eyewear businesses that we also have LOIs with, and use them to basically cascade the use of our tool to the end users. So this is the intention for the first phase, let's say. Then we want to replicate the same thing, hopefully in 2026 for the US, once we get the FDA certification. And then we want to kind of switch to more impact way. I assume that might be sometime around 2027, where we would focus more on developing countries and then perform this more in B2G2C cooperation. And for this, actually, we also have LOIs signed with like 7 different countries from Africa with different organizations related to local ministries of health. But because of the time to enter the market there and like more challenges with generating revenue, this is something we put as our phase 3 in this track line. Does that answer your question?
It does. Thanks.
Thank you. Thank you.
Maybe a follow-up question on that. What do you expect will the use of your product be? So in a B2B2C case, probably having a licensing fee with the B2B corporation, and then how often are the end users using the product?
Yeah, so that's the right comment that we expect the business partners, so the middle B in our B2B to B2C, B2B2C to be the payers. So we don't want the end users to be the payers. And when it comes to frequency, so I would say the global assumption for European Union, I would say, would be like once a year, performing this test by the end user. And then in developed countries, it can be more frequent. In developing countries, it can be less frequent. So like the boundaries here would be from multiple times a year to like once every 2 years, I would say. Thank you.
Maybe that's a follow-up question also from that. How precise, I mean, not precise, but what type of readings is your algorithm able to do, right? What kind of tests are you performing?
So
which you can still not perform, but maybe you will be able in the future.
Yeah, so right now we have a tunnel vision and very focused on the refractive errors. So basically what you get as a result is all the information that you usually need for having your corrective glasses prepared. So we have the spherical error, like DS, like -2, let's say. And then for astigmatism, we have the cylindrical error also in dioptries and the angle of astigmatism, let's call it. And we also can measure the pupillary distance. And this is the whole set of information that you might need for having your corrective glasses prepared. On the roadmap, we have different eye diseases that potentially can be also identified through this method. But on purpose, we don't focus on them at the moment just to deliver this application to the market.
Thank you.
Maybe another question on my side. Could you elaborate a bit more on the regulatory strategy? Because you mentioned FDA, but what about Europe and what do you plan to actually?
Sure. So the timeline is to apply for the medical device certification for the European Union. This would fall under Class 2A next year. So hopefully we will get this in the next like 15 months starting today. And then we can start monetizing the solution in 2025 in Europe. During that time, we want to engage in FDA certifications so that we are ready sometime around 2026 to sell in US. So that's the roadmap.
Thanks.